if you ask a patient in a consult and you tell them, okay, what type of neurotoxin they injected the last time? They're like, I don't know,
They
Botox.
don't have any.
They don't even know. Or what filler did you had? Oh, I had filler in my cheeks. Which one? Oh, I don't know. They don't really ask. And I always,
Yeah.
in some of my videos, I even say, ask your provider what filler they're injecting. Tell them to show you the syringe. Make sure the fillers are not expired, because
Yeah.
those things are very tiny details that what I can tell you. I, as a physician, I had fillers done before I even started aesthetics. I didn't even ask. And I was
Yeah.
a resident at that point, which you would think, okay, she's a doctor, she should ask.
Yeah.
I can't even tell you what filler. It's not something that patients ask.
Right.
So
Right.
that
Right.
becomes something where the patients are just trusting you blindly because they are
Yeah.
like, okay, I think she's a
Well, that's part of the problem, right? Because you're, I mean, as a practitioners, they do trust you.
Welcome to the American Med Spa Association podcast, Medical Spa Insider. This week, AmSpa founder Alex Thiersch is speaking with Dr. Linette Rivera from Glanz Aesthetics.
Hey, everybody, this is Alex Thiersch. Welcome to Medical Spa Insider. And we are very, very lucky and blessed today to have on the AmSpa hotline Dr. Linette Rivera from Glanz Aesthetics in Miami is where you're located, right,
yeah, I'm
Doctor?
in Miami,
Miami, that's
Florida.
right.
Hi,
Um,
everyone.
how is there a demand for aesthetic procedures in Miami? I feel like that's just a new and upcoming area.
No, here nobody is looking for any enhancements or beautifying
Yeah,
themselves.
it's just all comes natural.
I think
Um,
this is the mecca of, kind of like LA, the mecca of
it
aesthetic.
is. It is. It's Miami is such a different. First of all, I love Miami. Whenever I go there, I'm like, this place. I just think it's so cool. There's so many different cultures and people, but
Yeah.
there is just the amount of effort and money put into looks is really, really overwhelming
Absolutely.
down there. So we first of all, thank you again for joining us. Really appreciate it. You've been a friend of AmSpa's for a long time, and I know you've been in the industry for a bit, and you've certainly earned your stripes, and you have been a speaker at Medical Spa Show. I'm sure
Thank
we'll
you.
have you back. And we wanted to bring you on because for anyone who's in medical aesthetics, for those of you who are watching or listening, you've probably heard through media that there have been some publishing stories of some adverse reactions and negative results from med spas. Just in
Hmm.
the past maybe 60 days at AmSpa, we've flagged probably half a dozen or more stories, even from these are not small, there's some that are small outlets, but there's some that are, NBC News, New York Times, things like that, where they have really covered some of the obviously bad outcomes that have happened. There was a story in Illinois where a med spa was purchasing counterfeit Botox and was injecting it, and it got people sick. There was a death at the IV clinic in Texas that happened a while back, and there's been so unquestionably there's some bad things that have been happening. But what's been troubling us about the way these news stories are presented is not so much that these bad things have happened, because they have, and I think that's news, but they tend to paint with very broad brushstrokes and say, med spas themselves are dangerous, med spas are bad,
Hmm.
and that well, that chaps my ass for a variety of reasons,
Of
because
course.
it's not number one, it's incorrect. And I think it misses the context and it misses the bigger picture. And from my time being not only knowing you, Linette, but also everyone else in this industry, the number of safe, compliant, qualified, experienced med spas and med spa providers is overwhelming. It's
Right.
overwhelms the number that are bad. But unfortunately, those bad ones tend to give everybody a bad name, because when they make a mistake, when they do something stupid, it has an adverse impact on all of us. And we're not seeing a lot of good, positive news stories come out about medical spas.
Right.
And here at AmSpa, that's what we are aiming to change. So this summer and moving into all of next year, we are with the help of some PR and a bunch of articles and good folks like you, Dr. Rivera, we are going to start publishing and talking about the good med spas and how things are done safely and what the public should look for in a safe med spa. And perhaps more importantly, educating the folks in the media and the folks, some of the state regulators, as to what med spas do and to how and why good, safe med spas should, not only not be included in this attack, but actually encouraged to continue to operate, because it's the bad ones that we all agree have to get out of the industry. We have to fix that side of things. There's this underbelly of the industry brought on by, the fact that there's a ton of success and a ton of money and people are doing well, and that brings in all sorts of people. So this is kind of the Med Spas Are Safe campaign that AmSpa is engaged in. And there's a couple things I wanted to talk to you about, but we brought you on for number one, to talk about just what makes a safe med spa. And this is not, we are also painting with broad strokes here, but there's certain things that I think we've been hearing about more than others. There's been all the weight loss drugs. There's hormone replacement. There's all sorts of injectables and things like that are getting maybe more attention than others. But really what we want to do is show what makes a good med spa. What questions should folks be asking? What kinds of things should we be highlighting as an industry, so that we can, number one, put ourselves in a better light, and number two, kind of smoke these folks out who are kind of doing some of these nasty things, because they're the ones that are hurting us. And I say it's perfect that we've got you on, because, and this is nothing against Miami or South Florida, because I love it, but there have been a fair number of a certain type of issues in South Florida, which for whatever reason, there tends to be, I've seen this through investigations, a number of unlicensed providers who are providing services. So I think you're well qualified to be talking about this. So first of all, thank you though for joining us. And how are things in Miami after that long kind of negative introduction?
No, I love it. Well, thank you so much for inviting me. First of all, I think the reason why I associate myself, or I'm open to, working with AmSpa and you guys, is because I think you've paved the way to how to do things safely. When I started in 2016, I didn't know a lot of what are the rules, based on my state, who are the providers that are able to work at my med spa? What are the legalities behind, treating a patient, if I have reviews? So I think the years that I've been to not only the medical spa show, but listening to your boot camps and all the other activities you guys have, I think that has opened not only my eyes, but a lot of providers' eyes to doing things in a safe and correct way. The problem is, as anything, it's marketing, right? So anything, you can do everything right. And if something happens and something is done the wrong way, that's what ends up in the news. Patients don't know a lot about not only services, but also the legalities behind having a med spa. So then they get scared. Is my provider doing the right thing? Am I going to someone that's certified? I can't even tell you how many times, at least here in Miami, I have gotten a patient that goes in, I do a consultation, and they're like, well, I got injected by so-and-so, an esthetician injecting me with Botox, let's say. So things that are not legal in our state, because it's important to clarify this varies per state. It's based on the medical board or the nursing board. So I think not only patients should get a little bit involved in when they decide to go to a med spa, who is the provider that's available and up to being licensed to perform a treatment. But also don't think because in Florida we do it in a certain way, it means that in LA they do it the same way. So I think it's a key point where I tell patients, well, in another state, yes, estheticians or nurses might be able to inject Botox. In South Florida, unfortunately, no, it has to be a certain, NPs, PAs, or MDs who are the ones that can do Botox. I think also laws are changing a lot because they're realizing, nurses can now inject Botox with the supervision of a doctor, which not only helps us, but also, it enhances our practice. It also enhances their field because they can do other things besides working at the hospital. Right. Like you said, aesthetics has become a market where everyone loves it. Everyone wants to be a part of it. So I think the medical board is opening their eyes, and the nursing board to, let's be a little bit more lenient and try to come up with new regulations But if patients don't find out what those regulations are, they might just be going to a person that's putting them at risks.
Yeah,
And unfortunately,
it's
there's
true.
after bad events happen, there's what are you gonna do then? You know, you want to try to
Yeah,
prevent it before something bad actually happens, like what you're saying in
yeah,
Texas or all these places where people have died, unfortunately, not because I think the med spa did something wrong, but because the person that was doing the treatment wasn't certified and wasn't
yeah.
qualified.
It's so unusual, and I think it's unfair. You said a couple things that I want to unpack a little bit because I thought that was interesting. One, you're right. In Florida, for instance, there's actually been some moves, I think, in a good direction because you mentioned RNs. For a long time. There was an order out there basically prohibiting RNs from injecting aesthetic treatments. Now, I knew a lot who were doing it anyway, but nevertheless, that has since kind of gone away, which is good. There are other states, though, that we're seeing right now where the pendulum is kind of swinging in the other direction, and it's because of some of these stories that are coming out. But one of the things that you mentioned that I thought was interesting is patients who come in. Like, what is there a way you can put a number on, or what percentage of patients come into your practice who have been to others, express things to you where you're just like, wow, I can't believe somebody is doing that? Because it seems to me that there is a lot more, there are um a lot of these more unlicensed practice kind of underground places in South Florida for whatever reason than there are in other places. And I'm curious, is that something that's pretty common, and how do you respond to that?
I think it's very common here because the
Yeah.
demand is so high for aesthetics. I can tell
Yeah.
you, I worked in Tampa, and when I compared Tampa, which we're both in Florida, and Miami, the markets are extremely different. Like patients here, they love aesthetics. It doesn't matter if you are 21 years old or you are 65. Everyone asks about aesthetics. The
Mhm.
way that I even see, like in Tampa, I did have males. My male population was maybe 15%. Here, it might be 45%. In
Really?
aesthetics, yes. So all those things were at first, they were a little shocking to me because I was like, definitely people here, they are into aesthetics.
Yeah. Yeah.
The problem is, I think because we have so much competition here, some clinics try to cut corners to the point where they're, getting counterfeit Botox or overseas Botox that's not FDA approved.
Mhm.
Patients don't really know. If you ask a patient in a consult and you tell them, okay, what type of neurotoxin they injected the last time, they're like, I don't know,
They
Botox.
don't have any.
They don't even know. Or what filler did you had? Oh, I had filler in my cheeks. Which one? Oh, I don't know. They don't really ask. And I always,
Yeah.
in some of my videos, I even say, ask your provider what filler they're injecting. Tell them to show you the syringe. Make sure the fillers are not expired. Because
Yeah.
those things are very tiny details that what I can tell you. As a physician, I had fillers done before I even started aesthetics. I didn't even ask. And I was
Yeah.
a resident at that point, which you would think, okay, she's a doctor, she should ask.
Yeah.
I can't even tell you what filler. It's not something that patients ask.
Right.
So
Right.
that
Right.
becomes something where the patients are just trusting you blindly because they are
Yeah.
like, okay, I think she's a
Well, that's part of the problem, right? Because I mean, as practitioners, they do trust you. I'm curious when you tell them, like before, when you said, an esthetician shouldn't be injecting or asking about the types of fillers or whatever it is. Um, what are the reactions of the patients? Are they generally surprised and a little bit taken aback,
extremely
or is it
surprised.
just like, whatever? I mean, what's the
No,
reaction?
so I think they are kind of taken back, like, oh, really? I didn't even know.
Yeah.
Well, I thought estheticians could inject the filler or do stuff like that. Now, the other thing becomes pricing, right? So if you
Yep.
are trying
Absolutely.
to work with pricing, and someone that's buying product that's from overseas is going to charge a lot less than the products
That's
that are
right.
FDA approved. So I might tell them the price of our clinic, right? This is what I charge per syringe. And they might be like, well, for example, I had a patient that said, well, they inject my whole face with Botox, 60, 70 units, and I only pay $150. So I was like, okay, well, I would recommend that
Yeah.
you look at the bottle because the bottles are very similar. Some products are going to be, like you said, that all these patients that have been admitted because of botulism and all these side effects, those are not products that are FDA regulated. And that's what people that are actually wanting to get treatments done have to understand. FDA here pretty much regulates everything because they want to make sure that the things that we use as providers or the products are safe. But I don't think patients realize, because of they're trustworthy to whatever provider they're coming to. I don't think they're going to trick them.
Right. It's a good point, because the price factor, it's one of kind of the unintended consequences of when we talk about aesthetics. One of the things that people are very excited about is that it's all cash. There's no insurance, so you don't have to worry about billing insurance, all those headaches, the coding and all that kind of stuff, which is great. But on the downside, it does keep some folks out if they don't have the cash to be able to pay, and so they're going to go to places that are more inexpensive. I do think, though, it is a huge red flag when just looking at pricing. I think you can tell a lot about the compliance and the safety of a particular med spa, because if they're so cheap and so there's just no way that they're doing it on the up and up, whether they know it or not. It's because there's no way that you can that type of pricing can be done if you're buying product, FDA approved product from the reps.
Right. And I think it happens not only with products. It has happened to me. Like, I specialize in laser therapy. And here in Miami, which I didn't see that in Tampa, for example, a lot of providers buy devices that are from China. So then they bring the device, and I tell patients, I had for example, a consult the other day, and she's like, well, I thought that the laser was going to be $99 because this place offered it to me for $99. So I always tell them, look at your provider, what certifications they have, how much training they go to, because you can have the same provider with the same product or the same laser, and they're not going to treat you the same. Experience matters, trainings matter, how many years you've been in the industry, your artistry of how you use that product, how you use that laser, how you prevent complications, or if they do happen, because they can happen, we're humans. How do you treat those complications? Do you know what to do? So I tell them, just paying $99 is not only coming in, I zap you with a laser and you're done. It's more than having just a treatment done. It's what happens after the treatment. How do you prevent abnormal, reactions? And how do you even understand a laser from China that no one's training you? You're reading instructions that are not in English. How do you expose your patient to that? But they want to pay less for a laser without thinking of the consequences. So I think a lot of it is becoming that patient that asks questions and researches and says, no, I want to go to a spa that does things the right way, because after the complications can be disastrous,
Yeah. What's interesting is a lot of the news stories deal with IVs or semaglutide or even some of the adverse effects from injections. But really, when you look at lawsuits and when you look at negative outcomes, most of them are due to lasers and inexperienced people firing lasers and with burns, number one, and then number two, not understanding and being able to respond when the client calls back and says, hey, this is red or whatever, and they don't have that protocol in place. And it's just it's mind-boggling to me that people don't have that. But at the same time, it's obviously a very real issue. Are you finding, though, that I want to be hopeful that there is an ability in a lane for med spas like yourself to be able to operate and to be able to have folks appreciate kind of what you're doing and how you're doing it the right way, and at the same time getting away from some of these kind of lower level places that are just doing things incorrectly. And I hate to say that, because a lot of times those folks don't even know that they're doing something wrong. I mean, I've seen that many times where when I tell them, look, you can't, even though you're buying real Botox from Ireland, that is illegal because it's not FDA approved in America, and it makes it unfair for everybody else. What are you kind of seeing, though, as the landscape? Are you optimistic about kind of med spa reputation, or are you kind of worried about it like I am?
I think it's going to become more how we educate patients, not only when we have the consultations with them, but also through social media. I was actually talking to my social media specialist here and saying, we need to tell the patients when you come in and you get a laser, we have a messaging system where you can text 24 hours. If something happens, you're going to speak to the provider. You're not going to speak to a machine. So I think it's going to be everything. Aesthetics has grown since I started in 2016. It's crazy how it's become now.
Mhm.
And I think it's all about, like you said, setting up protocols that patients can say, okay, I think like I wrote on the blog post, you have to ask what happens if something bad happens. What are you going to
Mhm.
do as a provider? So
Mhm.
that, if they tell you, well, we'll figure it out, then that there's not a protocol in place. And
Right.
having a
Right.
protocol, having a way that the patients can contact you even after hours, because what happens is if they go to the hospital, there's going to be emergency doctors that might have never done aesthetics. They don't
Yeah,
really know what to do. In the ER, there's not even Hyaluronics. They don't
I
even have
know.
Hyaluronics for, so those things patients don't know. They're like, okay, I'll go to the ER if something happens, but they don't know they're going to encounter something that no one's going to help him.
Yeah.
So I think it's education, not only for patients, but also for providers. Like you guys do at AmSpa, taking more trainings of, what do we do in adverse effects, how to treat patients better, how to
Mhm.
communicate and educate patients better so that we can avoid all these adverse events that are just shading kind of like the aesthetic field. Because like you said, I think nobody does anything on purpose. I don't think
Right.
you do something for the patient to have a bad outcome. I think it's either you don't really know the law because maybe you haven't studied it, or somebody told you, hey, I get this product for cheaper. It might help your clinic. You might make more money. And you don't really realize, oh my God, I shouldn't even be doing this in the US. This is illegal.
Yeah. 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 I know. So we mentioned you've mentioned a couple pricing obviously is one of them. What are some like red flags that when folks are looking to come into an aesthetic practice for let's say they want to get toxin or whatever it is, and um what are some of the things they should be looking out for? Obviously, there's a bunch of stuff they should ask. You mentioned, what happens if something bad happens. One of the follow-ups I have to that is oftentimes patients don't even know what the bad outcomes could be,
Yeah.
right? So they don't know enough to ask. But what are some of those red flags for some of these med spas that are out there that we can tell people to avoid?
I would say, it starts from when you think you want something done to the point where you go into the website. I think
Hmm.
websites now in the aesthetics field have become very detailed. I think the patients should go into a website, read the credentials of the provider, kind of see before and afters, see how you can see, I think through a website, it kind of gives you a feel of how the clinic is. When
Hmm.
you go into a consultation, is how detailed is that consultation with your provider? Because
Hmm.
at least for me here at the clinic, I have an order, right? I ask you, how did you hear about us? What is it that you want to improve? How can I help you? Once
Hmm.
we get into, okay, this is what I would recommend, we start into a guide, right? So this is the laser or the toxin or the filler that I would recommend. This is the downtime. This is if it's going to hurt. What happens if something bad happens? These are the possible side effects. This is what I would do. So I think the more organized the providers are, I feel the patients are going to understand, okay, this is a good provider. A red flag for me would be if I go and you tell me, well, you need 50 units of toxin. I'm going to do your whole face. And they don't even explain what the toxin does, how they're going to inject, their
Hmm.
credentials, what can happen. Like you said, patients don't know to ask, hey, these are the risks. You shouldn't, lay down for a few hours. You shouldn't wash your face too hard. You shouldn't exercise for 48 hours.
Hmm.
Those things for me are red flags. If I go and the consult is 5 minutes, give me your money, let's go. That for me,
Yeah,
it would be a red flag. And
for
then the
sure.
website, I think if there's a website that doesn't have credentials, that should be a red flag. Where I go to a website and I look at providers and I don't see providers, then why is that? You want to promote, this is my provider, this is the trainings they do every year.
Yeah.
And then social media, I think, has helped a lot because there are people that showcase their treatments and there are people that educate, right?
Right.
So it's like I had a friend the other day, she posted, they asked me why I charge what I charge, but it depends, how many trainings, how many licenses, how many boot camps I go a year, because it makes us better. If you tell me a red flag for me, if you tell me you went to a training 7 years ago and you haven't sat down for one single training in 7 years, that for me would be a red flag.
Yeah. Yeah. It's so true. And it's a good point. The like what you can glean from a website, what you can glean from social media, what you can glean by asking basic questions. Like one of the things that always horrifies me is when, you'll have, and I've had this question asked all the time. The way that it's supposed to operate is you're supposed to have somebody like a physician or an APRN or a PA who is doing the diagnosis and setting all that up. The question I'll get from people is, well, wait a minute, if we don't have that on site on a particular day and somebody wants to get a treatment right now, if I don't treat them today, they're going to go across the street and treat with somebody else and I'm going to lose that patient. And the way it's supposed to work is they come back for a consultation. You can do all the things that you're talking about. And my response to that is like, if they're willing to get treated and they don't want to come back and do the proper protocols, then you don't want them as a patient anyway. That's a red flag for them. It's a red flag for you. Furthermore, like the fact that folks aren't like the physicians need to be credentialed as much as any part of the practice, because it's the physician who is overseeing the practice. Now there's some other, things with nurse practitioners and PAs, but nevertheless, I think some of the focus needs to be on the physician, what the physician is doing.
Absolutely. And I have been asked 1,000 times to be medical provider, right? For a different med spa, not my own. Hey, can you help us out? We're starting, we need a medical provider.
Yep.
It blows my mind how many of my friends are doctors. They are medical directors, and they don't know anything about aesthetics. And I'm like, what would you do if they call you in the middle of the night that they have a problem? And they're like, I don't know. I don't know. I mean, I'll Google, I'll text you.
Send them to the emergency room.
We have to have some sort of accountability as physicians. If you want to get involved in this field, it's amazing. You can be a medical director. I think being a medical director is a good way not only to get your feet wet, but also, make a little bit extra income. But you have to know what to do if they call you. You can't just say, well, I'm just going to collect the check. I don't know. I'll send them to the ER. No, if the NPs and the nurses and everyone who's doing the treatment goes to proper training, the same thing should be done by the medical director. They should know every single thing that happens in their med spa.
Absolutely. I mean, I tell that to doctors all the time, and you can't supervise a treatment that you don't know how to do yourself, right? So you can't supervise something, and those patients belong to the doctor. Like they're the doctor's patients, right? So under their practice. So if something goes wrong and there's a bad outcome or some sort of an adverse event, and they want to know from the doctor, and the doctor's like, I don't know, that's not going to look good before the medical board or on the channel, 11 o'clock news at night at all.
No, and then for me, I would feel horrible for the patient, because the part of it is, oh my God, I'm not, I wasn't competent enough to learn this ahead of time. And now this patient's suffering for this. And it's something that all of that can be preventable, so that's the biggest thing for me when I see all this news and, different magazines showcasing these things, is those things can be preventable if somebody says, okay, let's do this the right way and not cut corners and just do it for the patient.
Hey folks, it's Alex Thiersch. When it comes to injecting in the face, safety is more than skin deep. One wrong move could cause serious injury, hurt your reputation, and possibly endanger your business. That is why AmSpa partnered with the Academy for Injection Anatomy to create the AIA Advanced Cadaver Course, the most thorough and advanced facial anatomy course in the industry. Created and taught by renowned board-certified plastic surgeon Dr. Chris Surik, one of the foremost facial anatomists in the world, along with his hand-chosen faculty of the most experienced injectors in the industry. Students experience firsthand and close-up the anatomy of the face so that they can inject safely and confidently. Unlike other cadaver courses with large groups or limited access, the AIA Advanced Cadaver course provides small group instruction with a high faculty-to-student ratio and a limit of 4 students per cadaver specimen. Everyone who attends gets a chance to inject real product and then dissect cross-sectionally to see how close they came to vessels and other important structures of the face. This hands-on cadaver lab follows a full day of instruction on facial anatomy from our world-renowned faculty, including discussions of complication management, rheology, and an introduction to the use of ultrasound in your practice by Dr. Steve Weiner, one of the pioneers of using ultrasound as facial injections. At this 2-day course, students learn how to avoid common danger zones, how dermal fillers behave, and the best places to place product for safe, outstanding results. More than 3,000 aesthetic injectors have improved the safety and efficacy of their injection techniques with the AIA Advanced Cadaver course. Now it's your turn. Visit americanmedspa.org/AIA Advanced. Start your journey to safer injecting today. The AIA Cadaver course will be in New York City on September 20th, Nashville on October 18th, and finally in Orlando on November 8th. See you there. Yeah, it's tough. I mean, we've been, this is now, I started in aesthetics in like 2008, 2009, when I first started representing clients. And I have been giving pretty much the same lawyer talk to doctors about these exact rules from the beginning. And for whatever reason, in aesthetics more than others, there tends to be kind of this, folks just kind of look the other way and say, well, I'm a doctor. I can be a medical director for 10 places. And they just don't think about it in the context of the practice of medicine. These are medical treatments. This is the practice of medicine. This is your license and livelihood on the line. But for whatever reason in this industry, it's kind of become this area where it's not really medical. At least that's how it's perceived. And that's very, very dangerous. And I think what's interesting about this, and I'm curious what you feel about this, because you are an endocrinologist. You didn't start off in aesthetics. And in fact, nobody really starts out in aesthetics unless you're a plastic surgeon. You really don't start out in aesthetics. But people are always, and I'm always struck by how the news organizations that I talk to, and I'll give an interview, they are very, very surprised when I tell them, no, you don't. Like, any doctor can do aesthetics, any provider, as long as you're trained. And I can just see their minds blown. Like, well, what do you mean? They don't have to go to a special school. They don't have to get a board certified. And it's like, no. But that's how it works with most areas of medicine. That's not special, but for some reason that just kind of blows their mind. Would it be helpful to have some sort of a formal board certification for aesthetics that's not plastic surgery, that's not cosmetic derms? Because that's maybe the only way that we can do that, right?
Yeah, I think at least require some sort of training, because I think, when it comes, derms do a little bit of aesthetics. Like you said, besides plastic surgery, there's no one else in medicine that does any aesthetics.
Right.
But I think if there's some sort of regulation that says, okay, well, you can't be a medical director until you go through this, whatever many, trainings, and you have a certification from people that are training you that knows the laws in your state, then I think that would be something that would put patients at ease first. And then second, also providers, because imagine being a nurse practitioner, you're there by yourself, you're injecting. If you have a situation, your medical director, you call them and they say, well, I don't know. Then now you're freaking out because the patient's in front of you. So it's more than just, I'm just a doctor. It's fine. I can do anything. I can tell you, when I started in 2016, I took a basic training for toxins. Then I took an advanced training before opening a clinic, an advanced training for Botox, an advanced training for cannulas, all these trainings, because my mind behind it was, okay, we go to medical school. we become physicians. You go into residency, and your first day, they ask you for Tylenol, and you're freaking out. You're like, oh my God, how are the liver enzymes? I don't know. Am I going to prescribe Tylenol? Do I give 500? Do I give a milligram? Because you're dealing with patients' lives in the hospital.
Right.
It's the same thing when we come into an aesthetic practice. Being a med spa is not just getting facials, but it's knowing about the skin, about how this patient is going to react. If the patient reacts in a certain way, what are we, going to do about it? I had a derm once said, I don't treat anybody until I know 100% what condition they have on the skin, because you can do something that worsens what they have. So I think that's a great point. I think there should be some laws that are, medical spas are opening all over the U.S. that kind of put a little bit of a guideline of saying, okay, we are okay with you being a doctor, but I think you need some sort of training. And the same thing, if we're going to allow nurses to do it, okay, well, you need this amount of hours that we do,
Right.
or just, like you said, do a residency program where you want to do aesthetics, then get in a residency program of a year or whatever it is, and then you can start.
Well, and you have a very unique, but also very common perspective, because when we do our data research in this industry, most new owners tend to be just like you. They're physicians who are working in some other discipline, and they have had enough for whatever reason, and they come into aesthetics, but they have to learn it. You can't just start. So I'm curious from your perspective. First of all, what was your? I mean, I know you were a endocrinologist. What did you work in a hospital? What was your kind of practice before you got into aesthetics?
So I did internal medicine, then I did endocrinology.
Okay.
I worked as an endocrinologist for 2 years.
Okay.
I loved working as an endocrinologist, but my thing was my time with the patient was so limited because of insurance. Yeah. So I had 15 minutes for follow-ups. I had 30 minutes for a new appointment. In terms of endocrine, imagine I have to check your sugars, read your numbers, show you about nutrition, read your labs, guide you if you have any questions. Some patients are going to start insulin. They've never been on insulin. So for me, it's started to get overwhelming, because I'm like, am I really like teaching these people, or are they just coming in, okay, increase your insulin 5 units, okay, bye. So it wasn't the type of medicine that I want to practice. So here at the clinic, I still see endocrine patients privately, and they have an hour. They can have questions. They have a messaging system that they can call. So I can put my hours because the patients pay me, right? Yeah. I'm not guided by insurance. Yeah. But in my case, I had to come from endocrinology and decide to do aesthetics, start taking training on my own, and start injecting everyone in my family, because, I'm not going to inject the patient. I know my family is not going to sue me. So let me try.
It's true.
So I think a lot of us start like that. And then I decided to open a clinic, and I can tell you, you're a lawyer. I started Googling permits that I need in Florida. What county permits do I need? Because there's no guidance. Now, I think there's a lot of consulting companies that have popped up that are amazing because they help you with this. But at the beginning, back then, when we started, there's nothing. It was all, okay. I will tell you a funny story. I opened the clinic, and maybe like 3 months into it, a firefighter comes in and says, I need to see your fire extinguisher. And I'm like, oh my God. And he's like, yeah, you guys didn't certify the clinic with, the fire department. And I'm like, oh my God, I'm so sorry. So my partner's like, do we get that? Where do we buy the fire extinguisher? Do we get it on Amazon? And I'm like, oh my God.
Can we buy it from the fire department right now?
Yeah. So it literally, that's how we started. And I feel it's kind of like not only filling yourself with what needs to be done, but also asking others, like people that have been in this industry for years, hey, help me, I'm kind of opening, what permits do I need? Or hire a consulting companies. I know AmSpa brings to the medical spa show really good ones that can guide you based on your state, based on what you need. But I went fully from endocrinology to aesthetics. Then I started getting into laser therapy. So that was a whole other training. And part of it is how much you risk kind of going a little bit outside the box with your patients, doing it safely so that eventually others can learn from what you develop.
Right. Is that, when when you first started, like what drove you to open your own practice? Was it literally just you weren't having control of your time? Did you always want to be a business owner? Are you like an entrepreneur at heart? And by the way, just we were chatting before we started the Glanz Aesthetics, and totally caught me off guard because I didn't put two and two together, but endocrinology deals with glands and hormones and things, right? Among
Right.
other stuff. So,
Absolutely. So yeah, so I always wanted to have a practice. Always, always,
okay.
always. So when I finished medical school and then I went into residency, I wanted to have kind of like a multidisciplinary kind of like clinic.
Yeah.
Um, but when I finished, and I think I graduated 2015. So at that point, it was more of like, insurances are starting to cut off. The time restraints with the patients was an issue. So I worked for 2 years. I worked outpatient clinic, and then I worked in the hospital in the ER. So I was doing both for
Okay.
2 years. And I was like, I don't want to have time restrictions when I see the patient.
Yeah.
And
And
I,
just real quick, who like
yeah,
how was that dictated to you? Was that like the hospital saying, here's the rule,
yeah.
or is it like, does that all come from insurance? Like, where does that come
It's
from?
all based on insurance and then what the time allotted that you can do, because you have to
Hmm.
make a certain amount of money in the day to cover your salary, the MA salary, everyone's
Yeah.
salary. So that's stipulated by the hospital. And then you know how it is. Patients don't come on time. So then, from
Mhm.
15 minutes, they come 10 minutes late. I have 5 minutes. The other patient's already there. So it was a lot of that, I feel, because patients have to be there. They don't always have the best attitude, like,
Mhm.
okay, I'm here, I didn't do my labs. Well,
Right.
I need a refill of my prescription. They're not coming because they want to see me. They come because they have to. They need their medicine.
Yeah. Yep.
And I, so I said, okay, I'm not opening a medical practice. So then I said, I love getting Botox. Let me go and try a training, one of those courses of a weekend. So I went and I loved it. I was like, oh my God, I love this. So then as I started learning more how to inject and all that, I said, okay, this is a route. It wasn't as competitive as it is now. So it was a route that I was like, maybe I
Mhm.
can do this. I can open a practice. So from there, I opened the practice in Tampa.
That's
And I was
awesome.
there for 7, 8 years. Sold that one, decided to move to Miami to do it again. So I'm a little bit crazy. Um,
A
but
little
it's
bit,
something
yes.
a little bit. But I have learned so much as the years have gone by. Not only, like you said, we don't only learn in trainings, but also from other providers, from going to conferences. It's become such an enriched like community.
Mhm.
Like, it's very different for me to go to a medical conference than to go to an aesthetic conference. And I
Yeah.
think a lot of providers are seeing that, and they're like, you know what, I kind of want to go into that field a little bit. I don't have to stop doing medicine because I love it, but I kind of want to do a little bit of
Yeah.
aesthetics because the quality of how the patients come in and how thankful they are, and they love
Mhm.
coming to see you. I always joke around, when I was an endocrinologist, I would save people's lives. I would have their sugars controlled. They wouldn't bring me one single box of chocolates. In aesthetics, I have gone to patients' weddings and their
Uh-huh.
kids, and birthdays, because they truly, if you are a good provider that really cares for them, you're not only treating beauty, but you're treating self-esteem, and
Yeah.
that for people is
Yeah.
everything. You
Yeah.
know.
And I think like when it comes to, getting the word out for good med spas, that's something that I think we need to highlight more of too, is that the differences that you make in people's lives is
Oh,
profound,
yeah.
and it can be overwhelming for them, but it's also not trivial. It's not like, oh, I think part of it is like they think it's this, sort of vanity where you're going to get aesthetic treatments. It's not as serious medicine. But I mean, when you think about what you're doing for someone and how they're feeling, I mean, I'm sure the stories you have, but it's transformative, right?
Absolutely. There's patients that come in with skin concerns that have changed their whole life. Like,
Yeah.
they don't want to take pictures because they have pigmentation on their face. I have fixed scars of patients that I had a lady that was bitten by a dog on her face. And she's
Oh
like,
boy.
I had 10 surgeries. I still have these huge scars on my face. Yes, there's gonna be always people that are coming, well, I never want to age. I want to be young forever. And that's okay. I think not judging others, it's whatever your journey is, it might not be my journey. I might be okay having wrinkles, but someone else might not want to have wrinkles. So we have everything for everybody. I just feel it is a big part of medicine because we're working with people's emotions. You know, when you look at yourself in the mirror, you can be depressed and have a major health concern because of how you look. And that's not less medicine than just working as a brain surgeon. I think it's equally important. I think you can be the most beautiful person also and be depressed and not be happy.
For sure.
And
No, and we're, you know,
providers.
It's interesting because we are so we know as an association where a lot of the new businesses and the providers are coming from. They're often physicians or the nurse practitioners or RNs who are in other disciplines. And it's everything that you said is true. Once they are exposed to aesthetics, the business, the life of doing it, the way that your practice works, just the gratitude and also the excitement of the industry itself, they tend to go into aesthetics and they leave their practice. We've been trying to educate like PAs and NPs at their national meetings, even physicians, general practice, family practice, because we know that's where the owners and the injectors are coming from. But we've had pushback from some of those societies and conferences where they don't let us bring even like someone like you in and educate on the world of aesthetics. And although we don't know this for certain, my theory is that they realize that once their providers are exposed to aesthetics, they're going to want to flee and go into aesthetics, and they're going to lose some of their own members. So it's interesting. Yeah.
I can tell you, when I first started, I said, I'm going to open an aesthetic practice. And everyone was like, oh, okay, cool. But nobody really thought about
what that means.
Is she really going to open this?
Yeah.
And I can tell you, I think I have maybe 20 friends in the entire US that have opened practices after, because they realize, oh my God, you look at these providers and they're so happy all the time. You know, they have fun at conferences, they travel, they still learn, they still have their clinics. And I always say, you don't have to separate medicine and aesthetics. You can do both in your practice. You can still have, you know, one day a week you do aesthetics, the rest of the time you do cardiology. I think you have to separate yourself from doing medicine and what you love. Just because I do endocrinology here, but I do it privately. I don't see as many patients as before, but I still have that sense of like, okay, let me fix their thyroid hormone. Let me do things naturally in a certain way. But a lot of it is in terms of, for example, hormones and weight loss. There's a misconception in the medical community that thinks we're doing things that are not FDA approved, or that we're doing things, you know, just because we want to make money. And that's not the reality of it. You know, if you look at a real provider that's doing things the right way, we tell the patients what to eat. We show them how to lose weight. We help them in whatever weight loss program you have. And we're still doing it in a medical way. But the difference is we're using different methods, not only, you know, medical medications, phentermine or whatever it is other providers used to use as internal medicine. We're still doing the same thing, but in a different way. So it is, and a lot of the practices are FDA approved, you know.
They are. I agree.
They are, but providers don't know. I had a lady the other day, she's like, well, my gynecologist doesn't want me to do hormones because she says that doesn't work. And I'm like, how does she know it doesn't work? Has she gone to like a conference? Has she studied the matter? She's like, I don't know. I don't know. Maybe she doesn't. She says that she can give me a natural pill. So I think it's a lot of misconception in terms of the medical community of not really learning outside the traditional medicine.
Yeah, and that's something that we have to work on as well. I'm curious, have you found that your background in endocrinology, has that, when these new treatments, like when it comes to hormone replacement, weight loss, has that helped you? Because I just mentioned before, I don't see many former endocrinologists that are in aesthetics. A lot of general practitioners, family practice, and so I know it's not, which is also what you did. But has that helped? Have you found that to be a help for when these treatments start to kind of come on?
It does. Absolutely. I think, you know, me having a background, it makes it a little easier for me when we talk about natural medications. And I can tell you, I combine a lot of traditional medicine or endocrinology with natural hormones or GLP-1s. I try to do both because some of the things, I think are misconceptions mostly.
Yep.
But at the same time, every patient's different. Like some patients don't want to do natural hormones. They want to do other types of hormones. In terms of like men, I might not want to do pellets. I want to do injections, IM injections, like cypionate, testosterone cypionate. So it's easier for me because I still have options for my patients, but you're 100% correct. Like I think I've seen in traveling the world, I think I've seen another one endocrinologist from the entire US that does aesthetics.
That's interesting. I wonder why that is. I mean, I think it's probably just exposure, right? They haven't been exposed. There's something to it. That's interesting. I think so we're going to bump up against time, but when you think about, and I'm sitting here, the wheels are spinning in my head. How do we educate? Because there's so much education that we need. We need to educate the patients. We need to educate the state medical boards. Honestly, the most horrifying conversations I have often are with the investigators and the people who are prosecuting medical licenses, because sometimes they're going after people who are doing everything right, but the investigators and the boards don't understand the business. They don't understand the medicine itself. But we also have to educate, I think, some of these folks that are coming out, like other endocrinologists, other general practitioners. How would you go about reaching some of those folks, some of these physicians or nurse practitioners, PAs, whatever they might be, RNs, who are in some of these other verticals, who haven't been exposed to aesthetics, who think they might want to, but they have no idea? Like, how do we reach them? Because we've tried through some of the schools and conferences and basically been denied. But I want them to know that, number one, there's training for them available, and there's resources for them. So, because the worst thing that can happen is these folks say, I'm going to get into aesthetics, and they just open up and they don't do things correctly, because that makes it bad for everybody.
Yes.
So I don't know, how do we do, like, we need a bigger megaphone somehow.
Well, yeah, I mean, I think a lot of it is going to be webinars, because webinars, you can, through social media, maybe email targeting. I think people are more open to webinars. You do it in your own time. You don't need to go to a state. You do it at home. Okay, let me see what they're about. But at the same time, I think, it's keep trying to get into medical conferences.
Oh, we will, for sure.
And I think as more data comes out, and as more, kind of like the outsider or outlier doctors like me, endocrinologists, cardiologists, the pulmonologists come out doing aesthetics and doing these webinars or training people or researching more, I think it's going to open those specific, doctors to doing and trusting that, okay, well, they're not just opening up and doing things crazy. They are science-based. They are FDA approved. I can tell you, I communicate a lot with the doctors that refer me patients, because I want them to learn, listen, this is what I did on your patient. This is why we do it this way. I write all of that in my note so that they can start learning and opening up their eyes a little bit through their own patients who they're referring. Yeah.
Well, one thing you said that was so interesting and is so true is that a lot of the, if there's an adverse outcome, if there's an occlusion or whatever that is, a lot of the ERs don't know what to do. And we almost need to mainstream that a little bit more so that they can understand, okay, you need to do hyaluronics. There's no access necessarily to ultrasound if that's something that's needed. So it's there's a lot of work that we've got to do from just a public information standpoint. But
yeah, absolutely.
More endocrinology, I think, is what we need. More.
With all of the new, I think there's another new weight loss drug coming out soon, who is very promising. But I think as that happens, I think more endocrinologists knowing about at least the wellness part of aesthetics, because maybe you don't want to inject, but at least knowing the wellness part of it, it's going to help our patients a lot. Obesity is an epidemic. That's why these GLP-1s have gone crazy with everybody because patients are losing massive amount of weight. And I think that's going to keep growing as peptides grow and all this research comes out. I think medicine is turning towards more, let's do things naturally, try to get you off medications. But unfortunately, those are going to be providers that have to do things outside of insurance.
Yeah. Well, and a lot of those treatments are the treatments themselves are non-FDA approved use of FDA approved drugs and techniques, which is not illegal. And that's one thing that people need to understand. It's like, just because if something is FDA approved, you can use it, outside of the, as a physician, if you believe that it's going to help and treat, and which is what you do. So I think there's a lot of education that needs to be done. Well, I would love to, unfortunately, we're going to have to cut off because we're out of time, but I would love to have you back because there's a ton of information I think that you can provide, to physicians, to the public. I know you're doing a lot with, weight loss, and I would love to get into that a little bit as well. I'm just
Absolutely.
going to see where things are going, but, I really, if folks want to, if there's an endocrinologist listening to you on the way to work right now and they want to reach out and have some questions, where can they reach you? What's the best way to get a hold of you?
Yes, so they can either email me. My personal email is contact us at glanzaesthetics.com, or they can reach out via social media, like DM me. I look at all of my DMs. I'm very active on it. So Dr. Linette Rivera, they can find me there. I'm always happy if it's a colleague that's going to improve not only patients' lives, but their quality of life. I'm always open to chatting with them. And there's always this environment is very different to traditional medicine. It's that we have fun. We like other people to succeed, and that's what it's all about, to make patients' life better and their quality of life better and our quality of life better.
It's so true. I hear that all the time. It's such a different atmosphere. It's very collaborative and supportive. And it's Glanz Aesthetics with a Z, GLAN. Is that how Glanz is spelled all the time? Or
no, so Glanz is actually
D.
comes from a German word, which means to radiate, like to glow.
Oh,
so yes. So
Did not
I
know
do
that.
take glands from the body, but not glands. So glands,
gotcha.
it means to radiate, to shine, kind of like what we want to do, not only outside, but also internally, for someone to shine just on the way they talk to people, the way they interact with others. You shine, you give that good, positive energy.
Well, and that's what you do. So honestly, I appreciate the time. I appreciate you taking the time, and we'll be reaching out again because we'd love to have you back. And thanks for everything you've done. You've been a huge supporter and a huge help. So thank you.
Same thing to you guys. Thank you for all your education, the trainings, how you open up not only physicians and provider sides, but also help patients. Absolutely.
Well, that's the next step. Thank you so much. Dr. Linette Rivera, Glanz Aesthetics, which means to glow. I did not know that. I learn something every day, in Miami. And thanks again. We'll talk to you soon. Okay.
Thank you, Alex. Have a great day.
All right. Bye.
Bye.
Thank you for watching the Medical Spa Insider podcast. Please make sure to subscribe to our channel for future videos and podcasts. For more information about the American Med Spa Association, please check our description below.